Hi, everyone. I'm really pleased to introduce you today to Maddie Dever. Maddie is a non-binary wheelchair user with a spinal cord injury and an autistic adult and parent of 5 children, with 4 who are also autistic, living in rural Eastern Ontario. Maddie advocates with both provincial and federal governments for inclusion and acceptance of autistic individuals and for autistic people and others with disabilities to have their own voice in policy decisions. I first had the pleasure of meeting Maddie as a fellow member of the Ontario Autism Advisory Panel, where we worked together to draft recommendations to the provincial government on autism policy. Maddie currently serves as the president and founder of Autistic Bridge, Inc., and is the co-vice chair of Autism Alliance Canada and Connect Well Community Health. Maddie has worked hard alongside other disability organizations and advocates pushing for immediate and lasting changes to disability supports at both the federal and provincial levels. And this advocacy also led them to run as a Green candidate in the 2022 provincial election. And that's just the tip of the iceberg. So I encourage you to visit the link, which I'll post on this page, to read all about Maddie's various involvements and accomplishments. It's an honor to have you join us today, Maddie. Thank you.
Thank you, Janet. I've been looking forward to having some opportunity to speak with your students for a while now, so I'm glad it's worked out.
And likewise, I've been looking forward to an opportunity to have you. And today's discussion is broad, and I know you could comment on so many of these issues from so many different angles, and I really appreciate having you today. The wisdom that you'll impart with us will be really invaluable for the students. So to get going, our class in this module is currently exploring issues facing people with disabilities and their caregivers. So I was wondering if we could start off by just asking you about some of the main challenges you've personally experienced and how they may have influenced your journey into advocacy.
Sure. I back in 2008, I got really sick. I had a severe 2 bouts of chronic prostatitis, and it physically moved things inside my body, and it kept me very, very ill. I had a shoulder, which was an injury from playing some squash, and I ran into the wall because that's what I do. He's like, I got the shot though, and my shoulder separated and tore, and I ended up having my arm frozen for in place for 8 months. So I had no use of my right arm. But because of the prostatitis, I wasn't able, there's severe pain in my back. I wasn't able to walk. So I was in a wheelchair with an arm that didn't move. And my health just went from being, a really active person to being a person whose health just, everything that I used to be able to do, all of a sudden I wasn't able to do. And there, I was not in a great place. Being disabled was something very, very complicated. But over the period of time, there was an aha moment when I had a pain doctor in 2013 who told me that there's no such thing as chronic pain as a separate thing from acute pain. All chronic pain is an acute pain that hasn't been dealt with, that you're dealing with for a period of time. And talking with him, realizing that my pain was real, and him, spending the time trying to figure out some of these things and getting some of them addressed, even though my pain level didn't go down, my ability to deal with it did. And from that point onwards, I had a very strength-based approach to dealing with things in my life. And I went on ODSP about that time because I was finding it really difficult to, I would maybe able to work for a month or two and then not at all for months because the pain level was just too much. Day to day, it'd be different. So I went from, in my 20s having, working in IT, making 3-figure salaries, to being on ODSP in my 30s, and really struggling to pay rent. I used to own a house, but we had to sell it to move closer to where all my doctors were. Everything became more difficult because the rules involved with ODSP, housing accessing housing is more challenging. Now, this is 2013, 2014, when the world was a little bit of a saner place. But we experienced a lot of the issues where with ODSP, it's not a benefit given to you individually. It's a benefit given to your family unit. So if your spouse can work, your spouse's income is included in yours. So, if your spouse is working, then you get less ODSP. If your spouse, even though like some of the benefits, like the prescriptions, some dental care, not all, some other medical things, like the rules of what we can get, what we don't get, are very arbitrary. But you're constantly you're from ever on that point on this, trying to find a way to survive, and make sure that you've got a roof for your head, you've got food for your kids. Everything else is they're all extras, and they're really difficult to keep going. So I've experienced ODSP. I've experienced trying to get equipment, like in this last 2 years ago. I was in a car accident, and I had severe spinal damage in both my neck and my lower back, and I tore my hip. But I'm too young for a knee replacement. Go figure. Sorry, hip replacement. Wrong body part. Haven't had enough coffee today. So I needed to get a wheelchair. I had a motorized wheelchair already given to me by an ex-girlfriend when she got a replacement, but it took a year to get one that actually fit me. And disability hits so many silos. It's not just income. There's income, there's housing, there's your food. Basically, the biggest challenge is incomes. If you don't have income, it's the first domino that sets the course for your life. You have good income, you can have good housing. You have good housing, you can have good food and nutrition. If you don't have income, you don't have enough. Housing is a challenge, and it can be precarious. And if housing is precarious, then it's hard to find a job or keep a job. And then the next domino is nutrition. Without good nutrition, then you have poor medical health, and all of these things. Every one of these dominoes affects your mental health. So it's trying to navigate these systems, which are, I'm autistic as well. Navigating systems is really complicated. If there is a rule book and rules and a set of things that always happen this way, I could figure it out, and I could figure the best way of doing things. But if there's unwritten stuff, if there's traditions or courses of action that people take, or networking, that's you're expected to be able to figure out your way based on the experience of other people. They're really challenging to find and know what to do. And one of the hardest things for me to do, and for a lot of autistic people to do, is this thing called self-advocacy. I'm involved in big capital letters self-advocacy as an autistic or a person with disabilities, advocating to change systems. But me, can I advocate for myself? It is the hardest thing to do. If I'm unwell, my abilities to speak get challenged. If I'm unwell, I get anxious more about what to do. And all of the things that you can see me doing right now, talking, thinking, and responding, they all start breaking down when you add a little bit of stress, a little bit of anxiety, a little bit of pain. So it's it's all of these things, and hours more of I could talk to you about others. But in a general, disability, puts you have barriers in front of you. You have issues inside of you, and when they hit, your path of life that you may have had before you had disabilities changes and changes again and again. Where these barriers are removed, we can go back down the path to try to right, basically the barriers are the things that push the dominoes down.
Yeah, yeah, no, that's a lot to unpack there, and wow, you've been through so many challenges. I loved your metaphor of the dominoes and how when one goes, they continue to fall. And bringing that back to like a policy level.
Mm.
Um, you mentioned ODSP. I was wondering
Mm.
if you could talk about at the provincial level,
Yeah,
what policy changes could better help the situation so that those dominoes fall in the right direction, lifting
sure.
people up rather than
Yeah.
pushing people down.
Okay. So the biggest most significant change that we could have is increasing and reforming ODSP. We we need to stop looking at ODSP as a social assistance program and start thinking of it as a disability benefit. There's an attitude. There's an attitude comes with being on ODSP that policymakers, some policymakers have had. It's very punitive, and if we changed it from something that's there as a uh, entitled, something that we're, I don't know if I'm sure the right word is, but it, right now we're looked down upon if we have it. We have all of these rules to keep us in place, to keep us down into poverty, um, that need to get removed. So the poverty line in 2020 was 2,200. This is before inflation. This is before these last two inflation world in it before the massively high inflation that we're experiencing now.
Yeah.
CERB, which was introduced in 2020 as a minimum amount of that people need to be able to survive in this pandemic, was 2,000 a month. And ODSP now, as of October 1st, for an individual is 1,228 a month. Doubling it will get us to 2,452, which is just about what the poverty line is likely to be for 2022. That would be the single biggest thing. Now, the one thing about that, this will help people that are on ODSP now. Those who are renting will be able, whatever they're renting at, will have the ability to pay the rent and have breathing room. Those who do not have rent right now, the average rent of a one-bedroom apartment across the province is 1,400. In some places, like here in Carleton Place, it's 1,900. In Toronto, it's 2,400. So it's not enough to just deal with ODSP. There's a need to look at how housing works. The other aspect of ODSP right now, which is something that a lot of people don't understand, ODSP is actually split into two parts. One is basic needs. One is a shelter allowance. So our parents give us this allowance but only this much that we can spend on housing. And right now it's 520. Right now, the maximum amount that the province gives you as an individual is 520. And I
Wild.
you are hard pressed to find a room, maybe a closet, for under 520. So to be able to live on your own, is impossible with ODSP. So forget, let's start, let's put doubling as the goal.
Okay.
But
Yeah, I just want to hold you there for a sec. So if you're given 500 and change for housing, obviously that isn't enough for anywhere in the province, let alone some of the more expensive places. So how do people survive?
They rent rooms. They're a roommate, or they do room and board, or they live with their parents. Now, here's the kicker. So we know that ODSP was just increased 5%, biggest increase ever. So bigly of them. If you are on a fixed housing and rent geared to income, right? So there are some options that will basically, you're able to rent, you give them how much you are based on your rent. So they do all these calculations so that they're right up to the your shelter allowance. If rent goes up, if ODSP goes up 5%, it increases the max. But if you're already at the max, it doesn't increase you up. If your rent geared to income, let's say, was $300, so you don't get, you would only get $300 on your ODSP. You're getting an increase of 5% on that 300. So it's not, a lot of the people that have secured their housing through rent geared to income didn't even get as much, that $50 increase that the rest of us are so thankful for. Sorry, there's a lot of sarcasm in my voice here.
Yeah, no, that's pretty warranted, I think.
Yeah. So putting them together, having one rate and having that increase with inflation, that's important. That should be a doable thing now. The other thing is, there's so many clawbacks that, you have the ability, the first $200 you earn, you keep 100%. Then 50% of everything else you keep. And it makes it really hard to get out of poverty. So what we really need to do is end these clawbacks. Instead of having, clawing things back, let's have a cap. You can earn this much, and then at that point, we'll claw back. The difference between you and the poverty level, so it's thin. That's where it makes sense to pull back.
Yeah.
And that's a huge thing. The other thing is, so there's all kinds of other supplemental benefits that ODSP has. There's medically. Pause for a second. There's all kinds of supplemental things part of ODSP for medically necessary food allowances, for allergies, for diabetic supplies. The interesting thing about diabetes, which is something that I also got triggered by the accident. So ODSP will cover insulin. ODSP will cover sensors or pinpricks to test your insulin, but it doesn't cover the wipes you need to use. It doesn't cover the needle tips. However, so you can't go to the drugstore and have it part of a prescription. You have to pay for it, and then they'll reimburse it. Who on ODSP has $50 at any time of the month? It becomes a challenge to all these little things. But a lot of the amounts that these things were set 5, 7, 10, 25 years, and they haven't been increased with it's the food, the additional amount you have for food allowance for allergies. In the last 2 years, the things that are covered by this, the cost has doubled. Now, other things maybe have been 10 to 20%, but certain things have been doubled or tripled or quadrupled. ODSP hasn't taken account of that, and it's still stuck in the 90s. So there's all these things, and a housing benefit would be helpful if we could not have to worry about dealing with landlords directly, because getting a new place, the biggest problem we have right now, other than the fact of how much it costs, but let's just say somehow we're able to find a way of doing it. It's we can't even get to that point because landlords are looking for rent to geared to income 30%, which is, by the way, illegal. It goes against the Ontario human rights. They've said time and time again that you can't do these ratios. You can't ask about income this way. You need to be able to show that you can pay something, but it shouldn't necessarily be by looking at income. So if it's 30%, we're never going to be able to rent, because in a market where you're actually outbidding people to paying high rent to get a place, the person on DSP, we're having fewer and fewer places that we can rent on our own. So we need to find some way with housing you know, when most people are talking about affordable housing, they're thinking about people whose incomes are somewhere between 70,000 and 200,000. Like, I remember in the last election in Ontario, Andrew Horwath was talking about these poor people who who are income of 200,000 and they can't find a place to rent. And I'm like, we can't find a place to rent because you guys are also trying to find a place and you're outbidding us in every single situation. And I have found, talking with a lot of politicians, they're not they're not even thinking about us anymore. Whereas a lot of the time, it was trying we were trying to get people from the lower income into middle income. Now it feels like we're trying to get people to push stay in middle income or push higher. And it's, one of the problems that we get are these unintended consequences. And you and I remember we had a member in our panel that constantly reminded us that the things that we do, we have to be aware of the unintended consequences of decisions that we make. And there are so many. And part of the problem is, I don't think that people in power hear enough from people that they're affecting, people with disabilities, to be able to explain the actual effect it has, which is one of the reasons why I stay very active in advocacy, and I work to build relationships with people in, politicians of every stripe and color, because they need to hear our stories. They need to hear them in a way that they're not feeling attacked. Not that there's anything wrong with the people that do heavy duty activism, but they need to hear our stories. They need to hear the effect that their choices have made. Because right now, every government decision that they make to spend money and not spending it on getting us out of poverty is spending it on our backs. And they need to understand that if they're going to do X, if they're going to build a highway, for example, then and not increase us to above poverty, that's a choice that they're making, but it has consequences.
Yeah, and it has consequences on people as individuals, but it also has consequences on the society. If we
Mhm.
think back about that domino effect,
Yes,
where you're actually ending up increasing costs to the healthcare system in the end
absolutely.
by not
Yes,
just taking care of people's basic needs for good housing and decent uh, living standards and nutrition. So it's actually
absolutely.
doesn't make sense from either perspective.
Yeah, I mean, if people are housed, right, so we'll put aside the income way, but if people are housed, then they have more of an ability to do things. So that could be work, it could be volunteer, it could be, being part of society, and
Yeah.
and being present to other people, you know, because one of the things that's really important for people to realize, and especially people with disabilities, is that our value is inherent. We're not we don't have value because of what we're able to produce. We have value because of what we are and who we are. And it's that's one of the reasons why the biggest problem that we have with the attitude towards ODSP right now is the concept that the best social work is a job. Well, the best social service is a job. That's not the case for people with disabilities. About 70% of us can't work or can't work much more than a little bit part-time. 30% of us can, but maybe not all the time. But so yeah, I'd love to see more options to help the 30%, even help some of that 70%, to be able to do some things, give us a path to volunteering, encourage us in other things that can let us be part of society. I'm not saying contribute to society, because I don't want to be it to be an economic thing. But when we're not able to have secure housing, then the ability to do that is harder. Um, Not having stable housing means that, access to nutrition and good food choices, when you don't have that, the cost that we'll eventually have to the medical system is high. You look at the difference between the cost of home care and the cost of long-term care, right? Home care has a small cost, long-term care has a large cost. But when we take away, when we keep people down and our health gets poor and we end up in hospitals, and we're the ones that are in the hallways. We're the ones that are waiting for, long-term care because we can't be out at home. The cost of not supporting us properly earlier is significant. The cost, you can fit the cost of doubling ODSP by, right now, the current government is trying to push through having Highway 413. The cost of Highway 413 could allow us to double ODSP for 3 years.
Wow.
The ongoing cost of maintaining Highway 413 could provide half the cost per year. There's a choice.
Yeah.
And we're spending money. So where are we also spending money? Why is the health and long-term care massively increased over the last few years?
Yeah.
It's because it's a reactive choice. We're not putting money into home care, which is also a big deal for people with disabilities like myself. I need home care. Like I'm really doing well. I'm sitting in a chair, we're talking, I have access to my computer. Outside of this chair, I need help for everything. I'm able to get to my wheelchair and I can go around. When I get to places, I have to get help to do things. But we've had home care decimated through this pandemic because, rightfully so, we needed to put all hands on deck, to quote a particular provincial leader. We've had to get people to move to long-term care because it was a significant issue. We had, before the pandemic, PSWs would be able to work. They would work part-time at several different LTCs or retirement places, and they would also work at part-time in the community. So they were everywhere because there's no place that there wasn't enough funding for them to work in any one place by it. So all of these PSWs had to make a choice to work in an institution or work in the community. But because of the amount that they were giving people to work in institutions, they made the right decision for themselves to go there. Because at this point, being a PSW was a pretty poorly paid option with very little movement on a salary scale. So what happens is the unintended effect is that home care got decimated. Home care in rural areas got doubly decimated because people did not want to travel, because what's happening during this time, gas prices are increasing. So the cost, in some places, it was costing them more than they would make in the hours that they were there. So that why bother? It's these things that politicians need to understand that, but if you need to put money before that. Every dollar spent proactively is saving $10 reactively.
Yeah. Yeah, I think that's such an important point. And it's one we've made kind of throughout the course, and I think it applies to this situation probably more than any other, along with environment and climate issues. I think you've done a great job explaining some of the issues at the provincial level. I was wondering, are there any advocacy issues you've been involved with at the federal level as well? And I know you have been. So
It's a trick question. Of course I have.
Could you expand a little bit on
Sure.
the level of government?
Okay, so 2 years ago, the federal government announced several different initiatives regarding disability on a federal level, and one of them, which I'm really excited about, is what they're calling the Canada Disability Benefit. So, what is the Canada Disability Benefit? To be determined, but basically, it's the idea is it's a federal supplement given to people with disabilities, similar to the GIS that's given federally to seniors, and the Canada Child Benefit. It's supposed to be an increase on top of whatever you're getting from the provinces, and it's to not be clawed back. The amount, I mean, the whole concept of this thing is to provide a level, knowing that no province no province is properly funding and supporting people with disability. Every single province has a legislated poverty amount that they give to people with disabilities. So this is to take the federal government stepping in, because people under so many different things, it's a human rights issue to not be to have people with disabilities kept under poverty. So the federal government stepping in, they're going to offer an additional benefit, which is also given the excuse to other provincial premiers to say, hey, we're just waiting on the feds. We understand that, you guys are really having a hard time right now. I wish we could do more, but at least the feds are coming to throw some money at it. So it's a good thing. It's something that what disability advocates are really trying to hammer to all of these politicians is that we cannot wait. We cannot wait for this to be studied. There's been so many studies already done. We cannot wait for a long legislative procedure, because right now it got introduced originally in 2021 in June. Then the next thing that the government did was call an election, so that got taken off of the when elections called, all bills die. And they waited a whole year longer to reintroduce almost identical bill. So it was the last thing they did in June. And the really good news is it was the first thing they brought back in for a second reading in September. I was really pleased to be there. So it's got to go through a process, through committees, through both houses to be eventually signed into law. And one of the biggest things that we're advocating is this needs to be done in 2023. We need a timeline now to say how it's going to get there. And if you can't get there next year with a permanent solution, provide an interim, provide something now. Now that we have medically assisted dying made, that is, they opened up long-term people with disabilities and long-term disabilities instead of just for people who are close to dying. A lot of people are considering and have chosen MAID because they can't afford to live. They're in so much poverty that the pain plus poverty is too much. And we need, the simple solution to the people who are choosing this is a stable income, an income that's above poverty. It's such a simple thing. Every choice that governments are making that puts money elsewhere or puts the decision further in the future means more and more of us are feeling that we have no other hope, that we cannot continue. And it's sad. It's like, I know of too many people that I've worked with and advocated online are no longer with us because of this. So the other thing that's happening federally is like one of the things that I've been pushing since 2019 is this concept of a national disability strategy. And I've been also involved in a national autism strategy, because with autism, there's so many silos. Every province deals with autism in a completely different way. We have 13 provinces and territories that have their head in the sand wondering, what should we do about autism? Let's do this, instead of looking to see what other people are doing. We have autism organizations, so many autism organizations that are also somewhat head in the ground saying, well, we should advocate for this and this. And researchers saying, I wonder what's happening in my province, not wondering what's happening elsewhere because they don't know how to look. So the idea of needing an autism strategy to have the federal government provide some guidance, some insight, maybe some money is a great idea. We need that for all disabilities, right? There's so many gaps into the supports that people have. Like if you have a purely medical problem, the Canada Health Act is there for you. If you have anything that requires things that are not covered in the Canada Health Act, or increase the supports and whatnot that you need. The Canada Health Act doesn't cover it, and it ends up with provinces who have a patchwork approach towards disability and accessibility.
Absolutely.
So
Yeah.
2 years ago, the other really cool thing that the government did is announced the um, the Disability Inclusion Action Plan, which is really a disability strategy, and it's the Canada Disability Benefits part of it. It's an idea of looking what are all the things that we can do to change rules, change things, so we can remove some of the barriers in the system and provide supports in areas that are not there. So I'm really excited about that. And we have the Accessibility Act, the Canada Accessibility Act, which is looking at putting standards of accessibility across things in federal jurisdictions and hopefully providing leadership into provinces. Again, we have a really interesting political system in Canada because we have 3 levels of government, some places 4, that all have their areas of jurisdiction, the areas that they're supposed to be responsible for. Federally, there are things that are widespread that would affect all or large portions of the country, and then the provinces are dealing with the things that are day to day affecting us. And then municipalities, which are making sure that we can get around the places that are the different responsibilities. And it's the federal government is assumed to have the larger ability to raise revenue to be able to support provinces that have, not every province has the same buying power, the same per capita ability to spend. So we have a system where we have money that can flow for different things, so that we have a similar level of
Services, quality of life.
yeah, exactly. Quality of life, regardless of what postal code you have. So, but there are areas like health, which are a provincial responsibility, that the federal government comes in with money to provide standards, and so that really any citizen can move anywhere else and get treated. It's the same thing with environment. This crossover, this crossover in a bunch of places. One area there hasn't been a crossover is social services, and that's the area where we have the most diverse ways of doing things across the country. And this is why we're affected. This is why people with disabilities, especially in some areas, like Ontario, has the greatest capacity to pay for big things, yet they tend to spend the lowest per capita on these things, on education, on social services, but they spend a lot more money in business and entrepreneur, and like things that spin the wheels of the economy. And so they're holding out hope that it's like, yes, we need to do things, but we need federal money to do it, and then we'll do it. And so we wait, and few of us, more and more. The other interesting thing about disability, it's the only demographic that will increase. And it doesn't matter what other intersection you are in, any other demographic, you still can be disabled. And we're experiencing probably in these last 3 years, the single largest disabling event. We have thousands and thousands and tens of thousands of people with long COVID, and we have no idea how long it's going to be for that. But we have a huge number of people being added to the roles of those who are disabled. Yet we're spending less money on it. And this is a problem that will only get bigger. And it really requires an attitude shift. And it requires allies on the ground to be able to hear, see, and help wherever they can, and to advocate for the policy changes, for the priorities to change, alongside of the attitude.
Thank you. I think that's such an important message. And I think we'll have to probably wrap it up there due to time. You covered so many really important issues. Is there any kind of final thing you felt like, oh, I really wanted to say, but I didn't quite get the chance?
Yes, question number 5, right?
But if not, that's fine, Maddie. We can leave it there.
Yeah, well, I mean, change takes time and patience. Change takes anger and pushing, and both, there's activism, which is, getting up, yelling, marching, chanting, and there's advocacy, writing to your MPPs, calling, getting meetings, offering solutions, offering, digging into, the mechanics of why things there are and where and how things can be. And there's allies, all right? We need people to do activism. We need people to advocate, in those back rooms, and we need allies to be aware and amplify what we're saying. Bring us to the tables that you're at. If you're in a meeting that's going to be talking about how to help people with disabilities, make sure there's somebody with disabilities there, right? We experienced in this pandemic supports for everybody, but not, one very small, tiny thing for people with disabilities. We weren't brought to these tables. We weren't listened to, and our lives have become so much more difficult because of the unintended consequences of good ideas that helped other people. And we need allies to just constantly read the room. Is there a table? Are we there? How do you get there?
I think that's such an important message for the students to take forward into their future professional careers. Who knows where all of you will end up, but it's so important to bring people like Maddie who have the lived experience to remind people what the realities is and what the priorities should be. So thank you for planting that little seed today, Maddie.
Well, again, thank you for the opportunity to be able to speak to your class. I look forward to other opportunities.
It was great to have you, and I'll post the links to your website so people can keep following all the great work you're doing, and hopefully some of the policy changes you've been discussing today will come to fruition over the coming years.
Thank you.
It's already been way too long. Thank you.
All right.